Hello, my name is Stephen Albertson. We're going to be talking about the appendicular skeleton today. Marked spots on it, hopefully for a better visual effect. We'll get right at it. The pectoral girdle, starting off with the clavicle. Clavicle has 2 points of articulation, one medially at the sternum, which is the sternoclavicular joint, and then one laterally at the acromion, which is the acromioclavicular joint. Just inferior to the clavicle is the coracoid process of the scapula, and just inferior to that, behind the ribs, is the subscapular fossa. Looking at the posterior side of the scapula, on top is the olecranon, and the olecranon comes down into the spine of the scapula. Superior to the spine of the scapula is the supraspinous fossa, and inferior to the spine of the scapula is the infraspinous fossa. Laterally of the scapula, on the scapula, is the glenoid cavity. Into the glenoid cavity goes the head of the humerus, the proximal end of the humerus. Proximal and lateral is the greater tubercle, and more medial is the lesser tubercle. Then going down the humerus more distally, towards the middle is a little notch, almost tuberosity, called the deltoid tuberosity. And then looking at the distal end of the humerus, the lateral is the capitulum, and the more medial of the distal end is the trochlear. In between them is a process called the coronoid process, right in there. And on the posterior side is the medial epicondyle and the lateral epicondyle, and in between them is the olecranon process, which the olecranon fits into. The olecranon is the proximal end of the ulna, right there. The other bone of the forearm is the radius, and on top is the radial head, and more medial is the radial tuberosity. Going down towards the wrist, at the wrist, the radius connects with carpal bones, the scaphoid and the lunate, for articulation, and the wrist actually, and the bones of the hand, the carpals, actually have 2 rows, a proximal row and a distal row. The proximal row, going from lateral to media, are the scaphoid, the lunate, the triquetral, and the pisiform. And the distal row, going from lateral to medial, is the trapezium, the trapezoid, the capitate, and the hamate. And the pollex is the thumb, and it is actually the trapezium that forms the joint with the pollex. Okay, moving down to the pelvic girdle. Of the pelvic girdle, there are 2 hip bones. They are connected by the pubic symphysis. Each hip bone has 3 bones that are connected into adulthood, fused completely. They are the ilium, the pubis, and the ischium. Of the ilium, the inside part, more anterior part, is the ilium fossa. On top is the iliac crest, and then more inferior is the iliac spine. posterior side is right here. This notch is the greater sciatic notch. Going inferior is the ischial spine, and inferior to that is the ischial tuberosity. And we look at the femur. The femur has a head that fits into the hip at the acetabulum. That is the hip joint. On the femur, the posterior side, proximal and more lateral is the greater trochanter, and inferior and medial is the lesser trochanter. Going down, at the distal end, medial is the medial epicondyle and the lateral epicondyle, and just superior to the medial epicondyle is the adductor tubercle. On the anterior side is two condyles. This is the lateral condyle and the medial condyle. In between them is the patella. Then we go down to the lower leg, and right here is the tibia, and here is the fibula. Here on the tibia is the lateral condyle and medial condyle. Here is the fibula head. And right here on the tibia is the tibial tuberosity. Going down further towards the foot is the malleus. On the fibula, it is the lateral malleus, and on the tibia is the medial malleus. In between the tibia and the fibula, there's a proximal up here, proximal and the distal joint. It's the tibia-fibula joint, connects them. Of the foot, here is the calcaneus. Here is the talus. Just inferior to that is the navicular. And then there is a group of 4 tarsal, and that is the cuboid, the lateral cuneiform, intermediate cuneiform, and the medial cuneiform. The big toe is known as the hallux, and the other toes are known as the phalanges. I think that's it. Thank you.